Oh, hello, everyone. Can you hear me? That's
Yes, we
great.
can.
It's wonderful
Hello.
to see you. Thank you so much. I am so delighted to be here. I can't even begin to tell you. I have to start with thanking Dr. Karani for the invitation and also for being an incredible mentor. I would not be here without her. And she has just been critical in my career over the last 15 years. So I'm just delighted to be here. And now you know where I am physically, so stop by and say hello if you're around. I am really delighted to get to talk with you today about what we do as academic educators. Let me figure out my mouse and yeah, excellent. There. Thank you so much. I'm going to start here to ground myself, to ground us a little bit. You probably know this. This is an excerpt from The Summer Day by Mary Oliver. I do know how to pay attention, how to fall down into the grass, how to kneel down in the grass, how to be idle and blessed, how to stroll through the fields, which is what I have been doing all day. Tell me, what else should I have done? Doesn't everything die at last and too soon? And tell me, what is it you plan to do with your one wild and precious life? I say this to start us off for a couple of reasons. One is that there is a lot going on in the world, and we have the honor of having this hour together with each other. It is a privilege. There's a lot of suffering around us, and I just want to take a moment to acknowledge that every moment we get to share with each other is precious. And then the second thing is, I just want to, this line caught my attention. Tell me, what else should I have done? You all have lived through two of the hardest years, perhaps in our memory, particularly right here with the pandemic and everything else that has gone on. You have kept your learners learning. You have taken care of patients, those of you who are clinicians. You've taken care of your colleagues, your team members, your families, hopefully a little bit of yourselves. So really, what else is our institution asking from us? Well, we are going to spend a little bit of time today thinking about us, which I would guess is maybe not something that we get a lot of time to do often. And so I'll invite you for the next hour to think a little bit about us and not our learners, not our patients, and not the people who need us around us. All right. So 3 goals today. Hopefully by the end of our time together, we will have had some definition of success of our roles as academic educators. We will be able to identify some tools to help achieve your success. I've included 10 tips here and would love to hear yours. And we will talk about how we create community to go there together. Oh, a word about references. Can I just ask you, I can't really see the chat, but Dr. Krani will help me. How many papers do you think have been published about us as academic educators just in the last 5 years? If you could just throw some numbers in. Let's see if I can possibly see you.
I'll do it.
Awesome. 20. I see 20.
20.
Good guess. Let me get another guess. 3. 120. Love it. Okay, very good. 100. Yes, very good. These are fabulous guesses. So just in the last 5 years, there have been more than 50. And so what I wanted to, I say that to let you know a couple of things. One is that I am sad that I can't show you all of the references that are behind this talk. This talk is about the literature and our lived experiences. I can only fit a couple of them, but there are great, great articles, and many of them Dr. Karani has written. And so when we have questions at the end, we will also ask her. And secondly, it's really, a lot of people have been talking about us. So it's about time that we talk about ourselves a little bit and see what we know about us. Let me do this. Maybe one more try. Aha, I got it. Thank you so much. We are going to start with hearing a little bit from you. What inspires you to, why are you here? What inspires you to be here?
And they can unmute if they want.
Oh, I would love it. Are you willing to unmute and just shout some things out? I love educating. I see that. The food. Lifelong learner, thank you. Mentoring young people, absolutely. Your patience, growth. These are wonderful answers. Yeah, career progression, communities. Beautiful. Really learning from experts. Yes, exactly. See one, teach one, share knowledge, and help grow. These are wonderful. Paying it forward. Absolutely. So I start here because if we don't have a reason to be here, this is really, really hard work. So let's start with why we're here. And you share some of your reasons. I'm going to share with you some of what people have said in the literature. So in 2017, the AAMC surveyed 20,000 faculty over 25 institutions. They asked, why are you in academics? And you'll see that the theme of educating the next generation of physicians and scientists are shown on the left. And then you've got some work values here: variety, intellectual stimulation, service, fulfilling relationships. And then these wonderful colleagues of ours have asked, why are you an educator? And Dr. Karani is one of the authors for one of these papers, and you'll see some of the same answers as yours, that we're here because we want to provide better education. It aligns with our personal goals. We have and love our supportive networks. We have role models that told us this is a wonderful way to spend our career. Identity, personal affinity, aptitude, you were selected to do this. This gives us agency, and also some of us arrived here by serendipity. So I wanted to just spend 1 second on success and identity, because each of us will have to define success for ourselves. And we have heard it said by Sir William Osler, the first step towards success in any occupation is to be interested in it. So congratulations, you have definitely had the first step towards success. Some of these wonderful references have examined success and identity for educators through the social cognitive career theory, which frames it through 3 lenses: self-efficacy, outcome expectations, and goals. And we've also heard that despite all this, the single most dominant theme is that we're here because we're excited about our daily work. Some others include respect, recognition, dissemination, expertise, integration, excellence, leadership, innovation, relationship, autonomy, improvement, promotion, publications, all kinds of wonderful things that we get to experience by being here. And so I invite you now to define your own success. And then we are going to continue to talk a little bit about how to get there together. If you have decided that education is a part of your career, here are some select sample prototypical pathways. We sometimes abbreviated, and this is for the clinician educators. We're not all clinicians, but for example, for the clinician educators, sometimes we'll abbreviate it as big C, little c, big E. We'll talk about people who are master clinicians or clinical leaders, curriculum leaders, master mentors, education scholars. There are multiple pathways. Often people move through one to another. These are not set, but it is to give you a sense of the variety of things, paths that we can pursue and things that can fulfill us. Now I'm going to dive into tips. I've got 10 tips for you. The first 3 are about you. So let's dive right in. The tip number 1 is, if something interests you, make it your niche. What is a niche? It's been defined as a position particularly well suited for a person who occupies it, fulfills personal interests and passions, and can become the focus of your career. You don't have to have one. You can have more than one, but it's hard to navigate through without anything that interests you, right? Here are some examples of educators who have declared and are thriving in their niches in my institution. So Denise Davis on the left loves and is an expert in communication. Emily Silverman in the middle is someone who has always been fascinated by stories. So she started a podcast and it's called Nocturnus. And so she now collects and shares incredible stories from our work. And Gurpreet Dhaliwal, who some of you might know as well, is someone who has said, I am absolutely interested in clinical reasoning. That is what I'm going to devote my time to doing. Consider what a niche might be for each of you for right now. Tip number 2, let's just consider taking one next step. Life is incredibly busy and we can't do it all. And sometimes it's a little bit confusing about what we should do next. The next slide is not meant to be overwhelming, but I am going to just show you. This is a publication that we put out in JGen last year. I'm going to just point you to skills building. It's in the middle of this busy graph. All this is to tell you that when things get a little bit overwhelming, just pick any of these rows that are pertinent to you and your interests, and maybe just take one next step. If you are looking at building your skills and you have attended some topic-based workshops, you might consider a higher degree training program, for example. So we'll be talking about most of these a little bit later, but this is to let you know that wherever you are and whatever you're interested in doing, there is one small next step that you can do in the middle of your very, very busy days. Our third tip is to have you find a way to boost your skills. And again, we are all so busy. Why are we doing this? We're all really good at what we do. Well, it turns out that professional development, faculty development strengthens your identity and adds your skills. So it's something that's going to give you self-efficacy and has outcomes. So I think this next study was just done in the last couple of years. And they looked at faculty development in 3 levels. So low intensity, medium intensity, high intensity. The high intensity is what they're calling education fellowships or masters. Many of us have not had time to do that, but this is just to show you what is possible, what the outcomes are that are possible if you choose to do this. Now, I've called it higher productivity, and they have defined it by saying, if you have an education fellowship or a master's degree, you have an odds ratio of 2.6, you're 2 or 3 times more likely to publish more than 3 first or senior author papers, to have more than 3 regional, national, international talks, and 7 or 8 times more likely to have a dean's office role. And this addresses some of the gender disparity that we see in academics. So something to consider. So this section, we are going to summarize it briefly. 3 tips focused on you. 1 is to try to find your niche. The 2nd is to take one next step. And the 3rd is to consider boosting your skills. I'm going to move on to the next section of 3 tips, and this will be about your community. Tip number 4 is to just invite you to be in community. I am an extreme introvert, and it's been hard for me to activate this. Dr. Karani is one of the people who have taught me the importance of this, and now I'm going to share this with you. Community of practice, I show this because it's a theory of medical education. So if you're writing papers, this is often what drives what we do. And it also shows us that there are incredible outcomes that can come from being in community. Increased collective identity and shared purpose, increases knowledge and skills, career satisfaction, productivity. This benefits all of us. And so I invite you to take the time to reach out to your community. Now, what is your community consist of? The next tip is to invite you to have a network of mentors. Now, mentors, we've all heard about the importance. We variably have one or have some more than one. I want to invite you to consider adding as many mentors as you can to your network, because studies have shown that they help increase your skills, self-efficacy, career advancement, productivity, satisfaction, goal attainment, publications, promotion, retention, and decreases disparities. So there's a lot of evidence that mentors help you. And I can't imagine getting through my days without my mentors. And now, who are your mentors? Here's a sample mentoring network. Yours may look very different. For example, you might have education mentors right here. You might have education mentors from your national professional societies. You might have mentors in the other work that you do. For some of you, that's clinical. For some of you, that might be science. For some of you, that might be systems-based. And those mentors may be internal or external. Moving down the left side, you're going to need sponsors. I'm going to talk about that in a minute. Peer mentors are incredibly important. And your mentees are a part of your mentoring network too. Over to the right side, project mentors. There will be some things that you're working on that will be perhaps time limited, expertise dependent. And those are the people that you will want to have on your team. Successful mentoring relationships are, or have, they're reciprocal, they're respectful, they have clear expectations, clear, effective communication, and shared values. There's been a lot of studies on mentorship, and I highly recommend that you boost, expand, and make a robust mentoring network for yourself. We just said that mentorship is not enough, so we will talk a little bit about mentorship and sponsorship. There are some overlaps, and many people can be our mentors and sponsors. But what I invite you to consider is that a sponsor is going to help you in career advancement. I'm on the right side of this Venn diagram. They will help you on focusing on specific career advancing opportunities. It might be a transactional relationship. It does not have to be. It could be episodic. I tend to not necessarily agree that it's critical later in your career. I think it's critical anytime in your career. Sponsors are talking about you behind closed doors. They are the voices that lend you credibility when you are seeking an opportunity. So how do you find sponsors? Talk about yourself. And this is the next tip that I have for you. I would love for you to engage your networks in all the ways that you can. So how do you do that? I love this quote: we are a community of possibilities and not problems. And so there are some best practices to engage the people around you. So in terms of being a mentee or a mentor or a member of the community, you want to meet, and probably you want to meet more often than you are meeting. I've heard a lot from my colleagues, oh, I don't want to bother that person. They're very, very busy. Well, I am here to definitively tell you that it is the highlight of our days when you reach out to us and say, hi, I'd like to tell you what's going on with me, and I'd like to get your advice. There's nothing better than that. And you know that because all of you are mentors as well. So you reach out to your mentors knowing that that is how they feel about you as well. And then I would invite you to own the meetings. You run the agenda, you do the scheduling, do the follow-up. Just because your mentors are not reaching out to you does not mean that they're not thinking about you. So you can put yourself on their radar. Practice your elevator speech, tell your story, tell your stories where, tell your stories on your CV and your portfolio to your mentors, to potential sponsors, to your colleagues, to your mentees. Tell your stories in national meetings, in national communities, present posters, abstract, participate in workshops and interest groups. Just talk about yourself and you'd be surprised what happens. So the summary here, we have 3 tips focused on community. We want to invite you to be in community, to find your mentors, and to engage your networks. So we are now 6 tips in out of 10. Let me move on to the next section. But before we do, I just want to pause a moment. It is not easy to do what we do. I mean, that is like the understatement of the century. So can I ask you to share what is your challenge and what helps you overcome it? I'm going to pull up the chat. Time, triage, and priorities. Beautifully said. Balancing all the responsibilities, of which you all have so many all the time. Keeping the faculty to teach residents. I want to hear more about that, but teaching is hard. It's very, very hard for a number of reasons. What else? Finding time. I am seeing urgent but less important overwhelms the important but less urgent and long-term. That is really nicely said. We're constantly putting out fires, and so how do you find time to do what is important? Coordinating, I see coordinating among different departments, but maybe different roles. Culture change. Having partners to make the change happen. Balancing all the roles. Advocating for protected time for junior faculty. You all will have to tell me more about that. That's very hard at my institution. Maintaining engagement of others. Learn that from a mentor. Wonderful. building good relationships with residents while managing behind the scenes. We manage a lot of things behind the scenes, and you also have to manage what's right here. Aligning values. Michael, I don't want to put you on a spot, but maybe you can unmute and just tell me a little bit about that.
Just ensuring that we are all on this Zoom grand rounds because we have all drunk the Kool-Aid, but we depend upon others, lots of others, to help keep this process going and making sure that they're aligned with our priorities to help the next generation of physicians develop themselves as excellent physicians and educators and scientists.
Thank you so much. I really appreciate hearing that. Thank you so much. Yeah, I'm checking some of the other responses, just really wonderful input. Getting your great work out there. Some do it very well and others are shy to do so. I will say it's not just being shy, right? We are not given either the systems or often the training or really the support, the infrastructure to do so. So yesterday I had a conversation with a wonderful educator at my institution, and he said, it is a deficit of mine. And I said, it is absolutely not a deficit of anybody's. It's something that our system has not helped us do, but it is something that maybe we can help each other do. Asking that time spent on education is of equal value to time spent in direct patient care. My gosh, that gets us into maybe academic medical center financing, and there's a lot there. And then the changing playing field. Thank you all so much. Just incredible, just incredible. So let me come back to our slides and just share with you that you are not alone. I have the great privilege of hearing from educators across the country, and for the most part, we can just substitute the name of the institution and it really sort of all sounds the same. I don't know if that makes me happy or sad, mostly sad, but it also means that we're all kind of in the same boat. So the things that we hear right at home for us, recently we have just started a program for the Department of Medicine to support our educators, and we put out a survey in December in the middle of Omicron. And it just said, if you are interested in education to be a part of your career, write back and tell us a little bit about it. 200 people responded, and they told us that they have, often overflowing clinical load, insufficient time, support for education. There's no time, training, or funds for scholarship, just like you were saying. Lack of an education mentor, lack of an education community, challenges in learning, in the learning environment and learner experience. I want to hear yours, but it's hard. It's hard these days for us. There's often a mismatch between your job and your advancement expectations, and that's for us, perhaps for you. And so all of this means it's really a little bit unclear sometimes what success means. So this issue of time, it's important, it comes up. So we might as well take a look at it. So I looked in the literature, and it turns out that educators, as you have said, are interested in scholarly practice. Scholarly practice is not just producing scholarship, but it's applying a scholarly approach to everything that we do. We all want to do that. And yet there are a lot of challenges. And so our experience of the lack of time has been studied, and it's been broken down into some of the things that you've mentioned. So fragmentation, you find bits of time here and there to do what's important or not. Prioritization, we have things that are really important in some of our other roles. And so sometimes that takes time out of what we would like to do in education or in developing our own skills. Motivation, sometimes we ask, is what we do recognized, respected, or valued? And I look forward to hearing from you on that. There are various answers that I have heard there. And so people have wondered, how do we find bite-sized time? And I don't want to at all suggest that given everything that you are doing and doing so well, that you should just add this on and do this after hours. I know that's what many of us end up doing. It may or may not be what we should be doing. There may be some things that you can do during the day that can help us apply bite-sized time to developing our own education careers and interests. It is important to follow your inspiration. Many of us say that if I don't love it, I'm not really going to either choose to spend time on it or enjoy doing it. Some people in the literature have said, if you have 5 minutes, pay attention to what it is that you're picking up to read in those 5 minutes. That's something that interests you, and that may be something that you choose to do more of. Build a team. Do not do all this by yourself. No one can do that. And then the last tip is to try to see if you can make it count twice or 3 times or 4 times, or develop it into a niche. So now that we have addressed the issue of time, so 3 or 4 final tips about, well, what comes next? What comes next? Tip number 7, you've talked about scholarship, and I'm going to say that involves writing, talking about it, blogging about it, tweeting about it, and anything that you do to disseminate what you find interesting and what you have done. There is this fabulous AMY guide. AMY stands for, I think, Association of Medical Education in Europe, but it is really an international medical education organization. And they put out these guides. As you see, this is guide number 143, but this one is lovely. And it really just talks about how we can write collaboratively. And it breaks it down into a few different buckets. For you as the writer, you will want to know the literature a little bit. And for many, many years in my career, I thought, there's no way I have time to read the literature. When I started doing it, I realized, number 1, I'm not alone. And number 2, maybe I don't have to start from scratch on some of the challenges that I'm facing. Other people very likely have thought about it and tried some things and written about it. So consider engaging with the literature in whatever way makes sense for you. And then you will, some of you are probably wonderful writers to begin with. Others, like me, we have to work on our writing skills. And to do that, you engage your mentors and your peers and writing groups and anything else that you can think of that would be fun and helpful to do. We talked about building a team. You want a team. Consider definitely upfront how you will get ethical approval for what you're doing, if it's research, if it's reporting outcomes of any kind. Early on, you want to assign roles and talk about authorship, and that includes who is an author and what role authorship order might be. And then finally, to focus on the product that you're going to put out. Plan your project, have a timeline and deadlines, and then you just write and edit and submit and re-edit and resubmit. On the right is a lovely new piece that helps us remember that we want to get more juice from each squeeze. Love the lemon, making lemon juice. The ones that stand out to me, number 1 at the bottom of the tree says start with easy. That is really, really, I find really important. If you start with easy and you create something, you realize all the rest of them come much easier. I like number 2. We talked about that, produce multiple outputs. Anytime you create something once, think about how it can be shared in different ways. I also like number 5, collaborate. We talked about that. Don't do this on your own. It's much more fun with other people. Okay, tip number 8. At some point, you're going to have to say no to say yes. And at what point is that? I don't know. It's different for all of us. But we have seen studies where people have asked successful educators, or educators who made it a few more years down the road, when they have said no and when they have said yes. So let me start at the left and just show you some of the words of educators around us. So the first one says, I think it's really important to say no to some things. You can't do everything, and you have to pick and choose the things that you're going to do so you can do them well. The next one is, don't be afraid to say no, thank you, or no, not right now, to opportunities that may defer time away from your niche. And then if you are practiced in saying no, it will be fun to say yes. And so this quote on saying yes says, I just made it very clear that I wanted that. It was right around the same time some block was crumbling, and I asked for that too. So opportunities opened up. I really wanted both. My chair said, I don't think you can handle both. I'm like, yeah, I can. I got this. And you can only say that if you maybe have said no a few times before that, if you can. So tip number 9, I say change the system because the system doesn't really work well for us as educators. And there are ways that we can engage our system. So first, I want to encourage you to be active advocates in changing the system. There are many, many ways that we can change the system at our, within our team, within our unit, or within our division or department or our institution, or really nationally within our professional societies. And some of this depends on people around us, and some of it is not moving as fast as we would need it to. So in the meantime, I invite you to engage the systems that are working around you. And you have many right here. I am speaking to a group that exists, as far as I know, because of a wonderful infrastructure, the Institute for Medical Education. And you all have incredible resources. I have spent time on your website. I will spend a lot more time on your website. There's a lot of useful things here. And I'm just guessing that there may be more resources than you have had time to take advantage of. So other things that are just small examples of things that we take advantage of back at home, a mentoring program, you probably have that here. I want to hear more about that. Education scholarship meetings, conferences, works in progress sessions. Those are ways that we can advance our work with a community. So I'm looking forward to hearing from you about other systems that work for you here. We are coming close to the end of the didactic portion. And so I just want to take a step back and say, all right, all that sounds good, but what if sometimes I'm a little lost? That is possibly not any of you, but it is many people around me, and it is my experience through much of my career as well. Well, I just to put it out there, want to say the truth is we're all a little lost sometimes. And I know this for a fact because I have the honor of hearing from lots of people around me. And even people who look like they've got it all together, it's not like that. It's not like that for anyone. So if you're feeling a little bit like that, you are not alone. I would like to honor your impact and say you have already done great things. Your impact is already amazing. It's probably okay to take a moment, take a pause, make a shift, restart. No one's career moves in a linear direction or in a straight line from one thing to the next. And in that process, I hope you will speak kindly to yourself. Many of us are a lot kinder to the people around us than we are to ourselves. I hope you will celebrate your successes with your communities and just take one step in this very, very long road of your life's work. And so my very last invitation to you is to really be kind to yourself. As they say on the plane, put on your oxygen mask before you put on anyone else's. We spend all of our days and all of our energies putting on other people's oxygen mask. Take a moment and do it for yourself. I love this quote, treat yourself as you would treat a good friend. I venture to say that most of us have some work to do in that area. So the summary, 10 tips, there are probably many more, but these are the top ones that come to mind for me and top ones that come to mind in the literature. Develop a niche, consider what the milestones might be and what your next step might be, and build your skills. Find your community, find your mentors, and engage your network. Consider ways to disseminate in any form of scholarship that you enjoy. Make some decisions, say yes, say no. Focus on systems, both engaging the ones that you have around you and also creating new ones that you need. And always, always approach yourself with self-compassion. There are too many references. I cannot put them all here. I've only listed some, and I just want to invite you to reach out if there's anything that I can do to continue the conversation with you. I want to thank you so much for taking time to be here in the middle of your busy day. I think we will have some time for conversation, and I'm really looking forward to this section. Thank you so much.
Yes, perfect. So no, stay right there, Anna. So in the interest of where we